Hi everybody, I just wanted to come back and give you an update on how I'm doing. Um, I guess this month it'll be 6 months that since I've had my surgery. I did my surgery at Pompeii Surgical in Tijuana, Mexico on October the 25th, 2020. So a couple days now I'll be 6 months in. So I am doing well. My doctor was the golden boy, Dr. Galindo, and I have to say I have had really no complaints. As a matter of fact, even from the time I did the surgery, when I was in the hospital, coming home, adjusting to my new tummy and everything, I never got extremely sick. Of course, I went through some nausea in the beginning, and I saw everybody's experience is very different. So you can't really judge how you're going to do, but because I saw other people who had the surgery, other ladies there, they were, throwing up and just really having trouble adjusting to the surgery. Again, I dealt with a little bit of nausea, but other than that, I made sure I walked a lot. I followed every instruction that they gave me at Pompeii, and I never really had any major issues. I never threw up. And so I've been steadily losing weight. It did slow down for me. So I would say the first 2.5 to 3 months, you're dropping weight a lot quicker. Now I'm losing roughly between 8 and 10 pounds a month. So officially right now I've lost about 81 pounds is what I've lost. And I'm going, and you just kind of got to trust the process and make good choices, because once you get a little further out, you can still incorporate some things that you probably should not be eating back into your diet, which is why you got there in the first place. So you really need to be mindful. Now, I do hear a lot of people saying that they're doing keto diet after they go through the surgery, which that's your prerogative if you want to do that. The instructions I received was after you have the surgery and you start eating, to eat your protein first, your vegetables second, and then any carbs you might have, eat them third. So that's pretty much what I am doing. I don't have any restrictions or anything like that. I did have somebody ask a question regarding the holidays. What did I do? And my family told me before we had the surgery, they're like, look, we ain't playing that. We need dinner. Thanksgiving and Christmas, they wanted dinner. So I cooked dinner, and by Thanksgiving, I was able to actually, I think by then I can't remember how many weeks out I was, but I was able to eat just a tiny bit. So I did, and I was fine. So I made my usual Thanksgiving and Christmas dinners. One thing I have noticed since I've had the surgery is that my cravings for sweets are nowhere near like they was before, which is a great thing. So I don't really feel like, oh my gosh, I had dinner and now I want a dessert. It doesn't faze me the same way. Occasionally I will have something sweet, but it's not that big of a deal. And if I do have something sweet, I try to be very cautious of what type of sweet thing I get. Halo Top is one of the, like if I want some ice cream or something like that, I might do a little bit of Halo Top, and I can't even eat that much of it for some reason. And maybe this is a good thing because I loved ice cream before. Milk products are about the only thing that I don't enjoy them the same. Like they don't feel that great on my stomach. So I wouldn't say I'm sick and throwing up, but I have had a little bit of coffee here and there. And one day I did get so nauseous after I had some coffee. So yeah, I don't do that. I loved coffee before, couldn't live without it. As soon as I woke up, I wanted coffee. That's a completely different thing. One of the things that I also do now that I just started was, as soon as I get up, I try to drink a bottle of water. And I'm trying to make sure I'm incorporating more water every day, because it's really, really easy, especially with your restrictions of if you drink something, wait 30 minutes after you drink or eat, don't mix the two. And so I'm trying to make sure that I am getting enough water in my diet. I don't like water still yet. It's not my favorite thing. But, and actually it was bothering my stomach a little bit in the beginning. Nothing in a major way, but I just was like, ugh. But you need water. And if you're noticing that you're stalling and that type of thing, you're probably not getting enough water in your diet. So I want to talk about stalling really quick, because I've stalled probably twice in my 6 months. Once I stalled for about 2 weeks, and now I stalled for 2 to 3 weeks, but then I'm noticing that, you know, that I've broken my stall again. The scale started moving again. So what I want to say about stalling is a couple things. It is part of the process. It's normal. Try not to be too obsessed with the scale. Do your measurements, which is really, really important. But also, I am mindful of what I'm putting in my body. I'm mindful of what I'm eating, how many calories that I'm taking in a day. I don't have a problem eating 1,200 calories a day. I started working out and I do about 1,200 calories a day, and I lose with that. I feel comfortable with that. And so for you, you kind of gotta, I think, figure out your own body. If you're gonna do keto, that's great for you. I did keto for years before I did this surgery, and I just got really sick of it. And that's just me. There's nothing wrong with keto. I lost a lot of weight with it. I ended up gaining a lot of it back over the course of a year when I lost it. And that's just not the direction I want to go. So I am counting calories, and I'm making sure that I'm eating, exercising and eating right. And then I make sure, you know, for me, I get my cardio in, and I need to, what I realize is that I'm not drinking enough water. So that's very, very important, to get your water in, to make sure you're exercising, getting your cardio in, even doing weights and that type of thing, because your body is changing so quickly with this. And I know I was just like everybody else. You want to lose this quick. It's like you've been trapped inside of this body forever. Like you just want to lose the weight and you're just over it. And I get that. But the faster that you're losing, or let me say it this way, the slower you're losing, you're giving your body, your skin time, at least this is what I've been told, to shrink back with you. And I know I'm going to have some loose skin because I got a lot of weight to lose, but I'm not noticing a bunch of hanging loose skin. So that's a good thing. I'm not done. I feel like I might be a little more than halfway there. I want to lose at least probably 60, 70 more pounds. But I like the progress I'm making, because what I've been told is once you lose all the weight that you want to lose, they say to give your body about a year for it to shrink to where it's the skin to shrink back to where the smallest it can get to, which is why I think they make you wait a year after you lose weight to do skin surgery. That's what I've been told. Not a professional in this area, but what I'm trying to do is pace myself, make lifestyle decisions that I can live with. And so far, so good. So what I want to do now is just encourage you that wherever you are on your journey, trust the process, love your body back to health, because I know it's so difficult sometimes. It's when you don't love the skin that you're in and you've went so long not being happy where you are that you just want tomorrow to come now. And I get that, but embrace the journey, learn what you can learn, and just keep going. Because like I said, I'm only halfway there. I've got a ways to go myself, and I get that feeling of like, come on, you want the scale to move faster, you want to look in the mirror, and sometimes it's like fighting those old demons of not liking yourself or looking in the mirror, not seeing the changes, can be very difficult. So there's a lot of mental that goes into the weight loss journey. So I just want to encourage you today. I'm doing well. Maybe in another video, I can talk about some of the things I eat, and being in the gym, some of my workout regimens. But I just wanted to give you a quick update to let you know how I'm doing, where I'm at, and then hopefully next time I'll have some more pictures for you guys. I have been taking some along the way, but it takes a little bit of time to do all the editing and all that stuff. So life has been busy, but I'm praying for you. I'm excited for everyone who's reached out to me, who's had the surgery. I'm just so excited about Pompeii's community and the people that I've met. And whether you've gone to Pompeii or not, if you've done VSG surgery and you've struggled with your weight, trust me, I get it. It is not easy. It's not an easy journey, but it is rewarding. So I pray the best for you, and I look forward to coming back to you soon. Bye.